Have you ever wondered what exactly happens inside the body when someone has breast cancer? It's a question that might have crossed your mind, whether out of curiosity, concern, or both. A diagnosis of breast cancer is not just a single event, but a complex series of changes happening inside the body. It's a journey that science has allowed us to understand in profound and intricate detail. Today, we delve into the pathophysiology of breast cancer in a way you can understand. Breast cancer, in simplest terms, is when cells in the breast start to grow out of control. Now you might be wondering, what does that mean? Well, let's take a moment to understand what is happening here. In our bodies, cells grow and divide to replace old or damaged cells. This is a natural, healthy process. But sometimes, this process goes awry. Instead of growing and dividing in an orderly manner, some cells might start to grow without any checks or balances. This uncontrolled growth of cells is what we call cancer. When this happens in the breast tissue, we refer to it as breast cancer. These rogue cells can multiply and form a mass or lump, which we often refer to as a tumor. Most of the time, these tumors can be seen on an X-ray or felt as a lump during a physical examination. However, it's important to note that not all lumps are cancerous. Some lumps are benign, which means they are not cancerous and do not spread to other parts of the body. On the other hand, malignant tumors are the ones that are cancerous. These are the real culprits that have the potential to invade nearby tissues or spread to other parts of the body. This process, known as metastasis, can be quite dangerous, as it can affect vital organs and disrupt their normal functioning. So, how can you tell the difference between a benign lump and a malignant tumor? Well, only a doctor can make that determination, usually through a series of tests that might include a mammogram, an ultrasound, or a biopsy. It's crucial to remember that early detection can make a significant difference in the effectiveness of treatment. Regular self-examinations and mammograms are essential tools in catching breast cancer early and starting treatment promptly. Now that you know what breast cancer is, let's explore what causes it. The exact causes of breast cancer aren't fully understood, but we know it involves a damage or mutation in a cell's DNA. Our bodies are made up of trillions of cells, each with a specific role. These cells grow, divide, and die in an orderly fashion, overseen by our DNA, the master blueprint of life. But sometimes this process goes awry. A cell's DNA can get damaged or mutated, and this can cause the cell to start growing and dividing in an uncontrolled way. This unregulated growth can lead to the formation of a mass of tissue we know as a tumor, which can be benign or malignant. In the case of breast cancer, these malignant tumors develop in the cells of the breasts. Now, what causes these DNA mutations? Well, some people are born with certain genetic mutations inherited from their parents, but often these mutations occur after birth. They can be due to a variety of factors, including aging, exposure to environmental toxins, and certain lifestyle choices. Certain risk factors are also associated with breast cancer. As we age, our risk of developing breast cancer increases. Family history plays a role too. Women with close relatives who've had breast cancer are at a higher risk. Additionally, exposure to estrogen, the female sex hormone, over a long period of time can increase the risk. While the causes can be many, understanding the disease can help manage it better. Understanding breast cancer is the first step towards fighting it. Today, we've delved into the intricate pathophysiology of this disease, unraveling its complexities. We've explored its causes, shedding light on the risk factors that can potentially lead to its onset. What we must remember is the paramount importance of regular checkups and staying vigilant for early signs. Early detection is a powerful tool. It can significantly increase the chances of successful treatment and recovery. The fight against breast cancer is a collective one. It's crucial that we share this knowledge, spread awareness, and encourage conversations. Let's ensure that no one is left in the dark about this disease. Remember, knowledge is power. It's our strongest weapon in the battle against breast cancer. So let's wield it wisely and boldly. Subscribe and hit the bell for more health-related content. Together we can make a difference.